Governments scramble to up their preparedness levels. So far, 26 counties have attained or surpassed the required minimum 300 isolation bed capacity, while the remaining 20 are said to be on course. Kenya has also lost 3 more people, bringing the total death toll to 263. KTN's Mark Namaso brings us up to speed.
COVID-19 in Kenya seems to be still steamrolling itself to record-setting numbers. With some 6,754 samples tested, the total positive numbers are just 4 places shy of hitting the 800 mark per day.
We have 796 people having tested positive for this disease. And this brings the total number of positive cases in the country to 15,601, pushing our cumulative sample size so far tested to 200,061,027.
But on a positive note, 378 people have also recovered fully from the infection, bringing the total recoveries to 7,135. However, it turns out that a vast majority of the positive cases did not even know they were infected.
89% of them are asymptomatic, again leading to the emphasis that we've placed that this disease is really well within our communities.
But a report by the Ministry of Health points at an increase in domestic and gender-based violence caused by bundling together school-going children, adults and spouses. Turkana, Wajir and Kisii counties are leading in these numbers.
Close to 5,000 rape survivors have received medical treatment in health facilities during this period of the pandemic.
The Council of Governors, too, has indicated that counties boast a total of 11,934 isolation beds for COVID-19 cases. Some 28,661 health workers have also been trained on handling COVID-19 cases.
26 counties have attained isolation facilities with 300 bed capacity. 20 counties are working towards putting in place 300 beds by the end of the stipulated period of 30 days.
Meanwhile, Kenya has lost 3 more people to COVID-19, bringing the total to 263. Even with increasing numbers of COVID-19 cases, the national government insists it is in control of the situation. But most importantly will be the response of counties in the face of COVID-19 knocking on their doors. Mark Namaswa, KTN News.
And I want to focus on the continent to just bring you the numbers in terms of the COVID-19 related deaths. So far, according to the World Health Organization, of course, South Africa leading. It is the worst affected country on the continent. It is the 5th affected worldwide in terms of conviction, in terms of total number of infections of COVID-19. 5,490. That's the number of deaths in South Africa today. Of course, the last 24 hours announced on Wednesday, 572, the highest so far. In terms of active cases, 159,833, slightly more than 15,000 people have recovered from the disease. Slightly more than 229,000 people rather have recovered from the disease so far. Algeria is the second in terms of total deaths on the continent. 1,111 deaths reported in Algeria so far. In terms of active cases, 3,429. Algeria not doing so bad in terms of active cases. Nigeria is the 3rd country on the continent in terms of the total number of deaths so far, 813. 21,716 active cases of coronavirus. 15,815 people in Nigeria have recovered from the disease so far. Cameroon, 382 people have so far lost their lives from corona-related complications. 2,103 active cases of coronavirus. More than 14,000 people have recovered. In Kenya, Kenya is the 5th on the continent in terms of corona-related deaths. 263 as of today, as announced by the Health Ministry. 7,788, according to the WHO, active cases of coronavirus. Slightly more than 6,000 cases of people have recovered from coronavirus so far. 6th on the continent, the Democratic Republic of Congo, where 196 people have so far lost their lives. 3,639 active cases of coronavirus. 4,700 people have recovered from the disease in the DRC. Ethiopia is next. 188 people have so far lost their lives. 5,380 active cases of coronavirus. Senegal, 177 deaths so far, according to the WHO, with 2,836 active cases of coronavirus. Mauritania, 155 deaths, 2,004 active cases, and of course Ghana closing that top 10, that an envious list on the continent in terms of the total number of deaths in the continent so far. Let's now focus our attention and talk to Peter Dube, a journalist from South Africa, to just paint for us a picture of that situation which many people on the continent want to follow very